So I'm a TIDE affiliate. We have four fantastic speakers with us today, Doctors Millie Cowling, Jackie Yourell, Debbie Boeldt, and Elise Schenberger. Each speaker will present for around 5 minutes, and I will then take 1 to 2 questions depending on time. You may post questions to the chat or unmute yourself during the Q&A portion. As a reminder, these sessions are recorded for educational purposes only. And now I will turn it to Dr. Cowling to introduce herself and get us started.
Thank you so much, Stephanie. I hope you can all see my screen now. Great, awesome. Thank you so much, everyone, for joining this session. My name is Millie Cowling, and I am the evaluation lead at Kooth Digital Health. Kooth is the UK's leading provider to the NHS in digital mental health support. And last year, on the 1st of January, Kooth launched its new platform, Soluna, for youth in California, thanks to a partnership with California Department of Healthcare Services. And in today's talk, I'll be sharing some early results from an evaluation of the digital mental health platform from its first year of implementation. Just before I start, I want to disclose that all the authors on this work, Regina, Louisa, and I, are employees of Kooth, though none of us were paid for the results of this evaluation. To start with a quick overview, Soluna is a free and accessible platform that is available to all 13 to 25-year-olds in California, and it provides various support options, including self-guided behavioral health content and tools, a pre-moderated peer community, one-to-one coaching, and connection to other services through care navigation. As part of our evaluation strategy, we developed a survey to collect feedback every quarter from young people using the platform, and we named this the Stellar Survey. It was inspired by the Youth Services Survey that publicly funded mental health companies are required to complete at least once per year. Outcomes that we included were informed by the platform's theory of change framework, and items were either adapted from existing standardized measures or developed with stakeholders at Kooth. And the focus for the survey was really to include items that reflect early intervention and prevention initiatives, moving away from the kind of more typical standardized clinical measures, such as the GAD and the PHQ. The Stellar Survey was advertised within Soluna at 3 time points last year in 2024, and a total of 256 users participated. The insights that I'm about to share cover 3 key areas within the survey, and these are youth preferences for support, user satisfaction, and improvements in some early outcomes. So diving into the results. The Stellar Survey first asks users to rate how important certain characteristics of the platform are for them. And the top 3 most important characteristics were that they can access it when and where they want, that they have access to trusted wellbeing content, and that it's easy to access from their phone or tablet. And this really supports what we know that youth prefer on-the-spot, one-time support. This is also highlighted in qualitative feedback that we received from one user aged 17, who the quotes provided on the right of the slide said that it's made them feel more comfortable, that they can book a chat with a coach at any time, and that the app is available to them to use 24/7. This next slide presents results relating to user satisfaction. And among survey respondents, 97% reported that they would recommend Soluna to a friend, and 82% are satisfied with Soluna overall. And this really highlights that the platform's support is aligned with user wants and needs and contributes to a positive overall experience. Lastly, the evaluation provides some early evidence that Soluna is having a positive impact on youth. Since using Soluna, 74% know more about where to get help when they need it, and 82% have learned that they aren't the only one going through certain things or feeling the way they do. Among returning users, we also see improvements in mental health literacy, with results showing that 86% of respondents reported that if someone close to them was struggling with their mental health, that they'd be better able to listen without judging or criticizing. Taken together, these findings highlight the potential of digital mental health support to improve outcomes for young people. Findings will internally inform the ongoing development of the platform, Soluna, and as well provide learnings for evaluating digital mental health interventions in early intervention and prevention spaces during real-world implementation. In terms of limitations, though repeated cross-sectional surveys, we can observe and look at population trends. Individual level changes can't be measured, which may limit the ability to identify some of those underlying influences of the population level trends that we see. And so as part of the evaluation, longitudinal studies will complement these findings and provide more granular insights into those individual level changes. And thank you so much. Please do scan the QR code to learn more about Soluna, and I'd be happy to take 1 or 2 questions.
Great. Thank you so much, Millie. Any questions? I think we have a hand raised from Emma. Yeah, go
Hi,
ahead.
thank you so much for your talk. I was just wondering, when you were talking about the user satisfaction, were there specific aspects that they valued? Have you done any kind of more formal, either qualitative or quantitative analyses looking specifically at what it is that they valued? The patients themselves valued from the platform.
Thanks so much for your question, Emma. We have 2 quantitative feedback questions within the Stellar survey, one of which asks users to provide or to share some kind of positive impact and reason why Soluna has helped them, from which we've received a range of different responses, and a kind of more formal qualitative analysis of that free text is something that we're about to work on from over the next year, which we hope to provide some kind of more granular insights into exact areas, as you say. The kind of other side of free text feedback that we've received, users have the opportunity to provide kind of recommendations and suggestions on how we can improve Soluna. And so another thing we've been looking at and reporting back to different teams, whether that's kind of within our product team, is what can we do to kind of better meet those needs and to improve the experience for young people. And in terms of the kind of more broader characteristics as to why Soluna supports youth, as you kind of saw the kind of access, the flexible on-demand access that they're after. So I hope that answers your question.
Yeah, thank you.
And then there are 2 more questions in the chat. I think we can take these and then we'll move on. One being, how do you monitor peer-to-peer interactions on the app?
That's a great question. So our peer community is a pre-moderated community forums. So young people can post within those communities, but everything is moderated by one of our practitioners, kind of goes through human moderation before anything is posted to kind of review for certain, whether that be risk or language. And we have some clear community guidelines that users within the app have to follow, and if those kind of pass moderation, then they're posted within the platform. And that is the same with kind of any replies and responses to those posts. So there isn't any kind of private direct contact between users on the app. And one thing to also mention is that users are anonymous to one another, so they just have kind of unique usernames that are a collection of a few different words, and they aren't able to kind of identify who they're talking to in terms of they're anonymous to one another within the platform.
Fantastic. And then, okay, let's see. These 2, I think one is pretty quick. Can schools recommend the app to students? And then finally, can you say more about why you chose to develop the Stellar survey rather than use other kind of validated measures?
Yeah, great questions. In terms of schools, so yes, we a lot of work that our kind of on the ground engagement team do is to partner with schools and to work alongside kind of school districts to be able to share Soluna and kind of increase access and awareness of the support that we offer in partnership with the Department of Healthcare Services in California. So yeah, on the ground teams who go into schools and conduct presentations and other kind of partnerships with community-based organizations to really make sure that those 13 to 25-year-olds who have access in California are able to know that we're there to support. And second question, in terms of developing the survey. So as I mentioned, the survey itself was informed by another consumer feedback survey that, for example, the state of California for other publicly funded mental health companies or programs have to conduct each year. We adapted a number of items to fit the platform Soluna, such as some of the satisfaction items. So we kind of took those from that survey. I mentioned the theory of change framework, which I won't go into too much detail about, but it's essentially a kind of roadmap that outlines how Soluna's features connect to intended outcomes. And so there are a number of intended outcomes defined within the theory of change that we would expect to see improvements for our users, whether that's kind of different areas of mental health literacy, hope, sense of relatedness, connectedness to others. And we felt that for some items, there weren't appropriate pre-existing items that really capture what it is that we want to see for young people using the platform as that kind of early intervention and prevention support. So that's kind of the reason why we took bits from existing standardized surveys, and where we felt that the items out there just didn't meet what it was that we want to show, we start to build items ourselves, working with the different stakeholders within the company.
Great. And maybe you could quickly comment, were these surveys delivered through the app or emailed to the members or the participants of the app?
Yeah, great question. Thank you. So the survey itself is advertised within the platform, within the app. So it almost appears as if it's a piece of content within the content library. So users can come across it as they would be engaging within the app. We don't send it to their email addresses or anything. And they can click on the link, which then takes them to we host a survey within Question Pro, so a survey software where they can then read kind of more about what the survey will ask them and provide consent to take part and make sure they are eligible to take part. So in answer to the question, yes, it's advertised within the platform itself. So we recruit from within the app.
Awesome. Thank you so much, Millie. Great presentation. Next, we have Dr. Yourell.
Sorry, I'm just trying to request the screen share. Let's see. Bear with me a moment. Should be able to see just the presentation now, right?
Looks great.
Awesome. Well, this is a great segue, building off of Millie's presentation. Before I start, I do want to disclose all authors on this work are consultants or employees of Kooth, and none of us were paid for the results of this research. I'm Jackie. I'm a research scientist at FitMinded Inc. And FitMinded works very closely with Kooth to bridge science and business goals for Kooth and the Soluna product. Today, I'll be sharing results from an evaluation we conducted with Soluna implementation staff in the first year of implementation. Just for some background, we know schools are a great setting to reach youth and remove barriers to mental health support via digital tools by removing barriers like transportation, stigma, and access. But we also know the best designed apps don't have the greatest impact in these settings if they aren't integrated successfully, and implementation depends on a lot of factors and context. So people, timing, messaging, and trust. And we need to think beyond typical randomized control trials and controlled environments to really understand the real world conditions these platforms are living in and integrated into. To assess this with Soluna's platform implementation in June 2024, so last year, we collected open-ended survey responses from 13 Soluna implementation staff. These individuals were responsible for securing and maintaining school contracts in California and supporting Soluna's implementation. And we also did 4 follow-up interviews with these implementation staff, and they worked directly with schools and stakeholders, making them really uniquely positioned to share their successes and challenges in promoting Soluna's adoption in this real world setting within schools. And the goal was really to understand the challenges they were seeing on the ground, successes in implementing Soluna in schools, as well as recommendations and things that worked for them. What we found through the surveys and interviews is that there was several challenges in getting Soluna platform fully integrated into schools. And first being that, as we know, schools are always in high demand, having lots of responsibilities, dealing with lots of students. So they didn't have enough time or resources, they felt, to fully implement Soluna to its max capacity. And then second, school stakeholders, the implementation staff just expressed that, of course, schools are inundated with materials, and this can lead to unread emails or communications in reaching out to these stakeholders. Also, schools, especially in larger, more resource districts, are oversaturated with mental health offerings, making it hard to secure buy-in or see the full need for this great resource. And then schools, some were unsure how it could fit within existing mental health resources that they already had. And while the majority of parent responses were pretty supportive for the platform, there's just some who didn't understand things like why they couldn't access the app themselves, as Soluna is an anonymous platform for youth only. And of course, in today's age, we still have some older adults, mostly parents, still have stigma around mental health resources, or they may have feelings of, my child doesn't need help. So there was just a few instances mentioned of that, as well as some stakeholders misunderstanding the role of Soluna, thinking it was meant to serve as a crisis resource when it's really meant to be a preventative, everyday wellness tool. And stakeholders also wanted to, just had a desire to see the data on how this platform is impacting youth. So they suggested some solutions to these challenges, as well as shared what really worked for them on the ground working with schools. And they said it was really important to emphasize that Soluna is not a no lift effort, but it's a low lift. And they suggested it really worked for them to be proactive and schedule things like offering to come to career days that they noticed the school already had scheduled, just to reduce the burden on the school to coordinate that. As well as using media like newsletters, podcasts, and short videos to really communicate Soluna and its impact and resources and features. And really focusing on rural districts, as these were the most responsive districts, as we can imagine, since they have just expressed that they don't have a lot of resources for mental health. So this was a really responsive setting. And also just to frame the platform as complementary, as it can, be used alongside existing resources, as well as explaining how Soluna benefits youth and framing it in a way for parents that may even help their child to communicate with them about mental health, and potentially have a parent-specific version of the app just as a demo to see how it really works behind the scenes. And just emphasizing that it's a preventative tool for everyday youth issues, and not meant to be a treatment platform or for crisis prevention. And then finally, just sharing out high-level data on the platform's benefit to youth and data. So just taken together, our findings really show the integration of Soluna into schools depends on 3 main factors: just cutting through information overload with clear, simple communication to stakeholders, really tailoring support to schools' capacity, needs, and context, and then, of course, building trust through transparency and being really clear in the tools, platform's purpose, privacy, and impact that it's having. With that, I'll take any questions.
Fantastic. Thank you so much, Jackie. questions, you can write them in the chat or use the hand function and unmute yourself. I'll ask a question while people wait and come up with theirs. I'm curious about this kind of parent component and getting parents more involved or helping them learn more. And I'm wondering what youth might think about that. You know, how they feel about it being really more something that's maybe more removed from their parents, and what you think they would think about having their parents more involved in their use.
Yeah. Yeah, so it's timely because right now we're about to publish a paper on, we did a formal study with stakeholders and communities and schools. So not youth reported, but they expressed to us through this kind of feedback they've gotten from youth, and they really value that anonymous piece, that they can use it on their own, on their phone, most time without their parent knowing, and just have access, especially in settings where it is stigmatized, or they fear not being able to get mental health support. So they like that that's not a component, but of course there's nuance in that. There's probably youth out there who talk about it with their parents, that just was beyond the scope of that. But they really do value it being an anonymous platform that they can autonomously use on their own.
Yeah, that's really helpful. Thank you. A related question in the chat: do you have any specific examples on different strategies that might help increase parent buy-in or reduce parental stigma?
Yeah, so obviously one option is to host like educational, either virtual or within schools, sessions around educating parents around mental health, and also just again framing the tool not as like solely for mental health treatment, seeing a therapist. Is really supposed to be a skill building everyday tool for youth to go to. So those are just some strategies, but also with digital apps, just being really transparent and showing and telling the story of the platform, and being transparent in privacy protections and safety precautions, which Soluna does a really great job of having a, frequently asked question page on your website, so that it's kind of a one-stop shop for parents, caregivers to get all of those kinds of questions and information answered.
Fantastic. Thank you. For the sake of time, I'm going to move us to our next speaker. But if the speakers have some time to answer some questions that might come in the chat, that would be great. And if we have any time at the end, I can also kind of come back to some questions we might not have answered. So thank you, Jackie. And next up, we have Dr. Boeldt.
Okay, can you all see this okay? Awesome. I'm excited to talk to you today about some work that we're doing at Aura. So I'm a clinical psychologist by training, a full-time employee at Aura as our Gen AI psychologist. So thinking about AI all the time, and also an adjunct at the Colorado School of Public Health. And so today I'm going to talk to you about some of our early findings around how we want to help educate and inform parents around this space that can be really challenging. So Aura is a cybersecurity company that also has features built out for parents specifically to help them understand their child's digital well-being, overall digital use. So it goes beyond just parental controls and turning apps on and off, and or turning phone access to apps on and off. And then you can think of it more as like a way to help provide scaffolding for kids to learn how to use their digital technology in a healthy way. And so some of the features that we're working on that inform parents are around AI, one of which being AI alerts. So if their child's using a high-risk AI app, which I'll talk about in a minute, and also around insights. So we can give them various insights leveraging AI that looks at their data, how they're using their data, and sometimes includes notes about, Emma was on an AI chat today talking about, educational content or something like that. And so two of the main questions I wanted to cover today is what concerns parents most about AI, and then how can we help them navigate this space? So as we think about giving parents specifically alerts about what their kids are using, but also just additional information about that, we want to be cautious about how we're giving the information and what benefits them the most. And so we ran a user testing survey of 201 parents that represent users of our product Balance, the app, the product for monitoring their kids. And the two main things that parents are highlighting of concern are privacy and safety. We then decided to take it one step further. And I should also mention, like, the overall concern of AI, use of AI was moderate. So ratings of, I want to say like 80% higher than 6 on the scale of 1 to 10. And so this is something that parents are thinking about. They're worried about privacy and safety. We then decided to show them different stimuli around what are things that AI can be used for, and some of those risks related to that. So companion apps, this is something that a lot of you are most likely familiar with. This is probably the most prominent in the news around folks using AI as friendships, girlfriend, boyfriend, all of that content, which can lead to either unhealthy relationship expectations, other things around dependency, less engagement with friends in the real world. But then there's some other ones such as sexual content, over-sexualized images, deep fake, being able to pretend you're someone else or you think you're talking to someone that's not actually them, and then grooming in terms of being able to, there's ways to circumvent age restrictions in a lot of these apps. Also, just the app itself, the AI itself may encourage you to do something that's not appropriate. There's a couple different ones here, but I don't have time to go through them all today, but I'm highlighting the ones that were then highlighted as the main concern from parents. So after putting these kind of different scenarios and risks in front of parents, we asked them to rank order what their most concerning were. And as you see here, sexualized content, grooming, and deepfake were the top 3. And I think one thing to note here is that one thing we noticed with the survey is just parents may not even be aware that these are risk factors. So privacy, safety, these all fall within that. But thinking more broadly, they don't maybe realize how significant these situations can be with the AI apps. And then also from our own users, we can tell that kids are using some of these apps that especially are more risky. And it's a subset of kids, but some kids who do engage with those apps aren't just checking them out 1 or 2 times, they're actually using them fairly frequently and with a lot of messaging. And so then we also wanted to understand kind of how much parents know about their kids' AI use. And so as you see here on the right, the children age 11 to 17, about 20% of the parents said they weren't sure if their kids were using AI. This is actually in line with some of the data from Common Sense Media that came out earlier this year, suggesting that parents aren't aware of kind of the AI their kids are engaging with. And also just noting AI can be integrated into common apps that they're using, whether it be Snapchat and whatnot. And so that brings us to the question of how can we prepare parents, or how can parents prepare and talk to their teens? I put a quote at the bottom. So we also run parent panels and discuss these different features with our panel. And one of the parents said, these are little breadcrumbs we get as parents sometimes if we're fortunate to catch them. And so the idea being that, like, if we alert them to Emma was using an AI app today, it actually helps serve as a reminder of like, oh yeah, I should check in with them and talk to them about it. Another thing that repeatedly comes up when talking to parents is that they want resources. So not just awareness of my kids using this or not, but what do I do? And so that brings us to kind of a list of different prompts or ways that we approach talking to parents. So if we do share information, things that we say that we try to align with to make sure that they feel empowered. And so I think first and foremost, we always say, you're the expert on your child. You know how to support them best. You also know what pushes their buttons. And so that's kind of the first thing you want to start with, but then also understanding that AI is evolving. And so trying to understand AI is going to be like a futile effort at this point because it keeps changing each week. And so the idea of being aware that you don't need to know all the answers and really just starting with the conversation is what matters most. We also want to foster open conversations. And so a lot of times when we're giving insights to parents, we'll give them information about their kiddo, and then we'll say, check in with them or tell them, ask them what they like to do on when they're exploring new apps, and just really kind of more taking time to explore what AI kids are using. And I should mention, these are kind of more general guidelines, but there are like more specifics that we get into when we're giving high risk apps alerts out in terms of like if it's sexual content or not. And then trying the tools yourself. So if you see that your kid's using something, trying it out, seeing what it is, really understanding it, at least at a high level. You don't have to like talk to it every day, but just understanding what this thing is. Because I think right now there's a lot of unknowns around AI, and we don't know what we don't know kind of thing. And then encouraging responsible use. So really highlighting that AI can be a really cool tool for learning creativity. A lot of kids use it for like drawing and whatnot, but also highlighting that it does have its limitations. So even though it may sound confident, which it often does, it doesn't mean it's accurate. And then encouraging them to think critically. I know there's been some news around this recently about kids not thinking as critically anymore, but asking them to kind of think critically about the stuff they're using, maybe even modeling it for your kid, saying, oh, I tried this app today and this didn't work. But there's a lot of different ways that we try to engage parents to talk to their kids around this space. And then the risks. So this goes back to the list of stimuli that I showed earlier. But understanding that AI, is just responses based on data. It doesn't actually know the facts. And then the limitations, right? The dangers of misinformation, bias, and manipulation. These are big things that we want to make sure that we're just safe all around. But this, especially in this virtual world. And then also being able to making them aware of what information they're sharing with these different apps is also really important. So again, going back to what I said at the beginning, really trying to provide scaffolding for kids, and this varies depending on developmental age. So being able to meet them where they're at. Some younger kids will need more scaffolding and more monitoring and more kind of hands-on help, whereas by the time they're teens, the idea is that they can check themselves and they can monitor themselves and how they're using these things. And then setting boundaries. And there's also a parallel here that I think us as adults can also engage in some of these things, but staying engaged in monitoring your kids' usage. This doesn't mean spying on them or constantly bothering them about what they're using, but really just being aware of what they're using, and then maybe setting boundaries for those apps that are harder to put down, but reminding them that ultimately you want them to develop, independently and have responsible habits, and your job's to keep them safe at this point in time. And as we know with AI, that's kind of a critical piece right now. And just thanks to my co-authors who are also employees of Aura. And I'm putting a plug at the bottom for a study that we're running for dyads with parents and with kids to monitor digital use.
Great. Thank you so much, Debbie. I think we have time for one question. Question in the chat. Do you tailor your parental recommendations based on the child's age? Some of these conversations seem more targeted towards older teens. Great question.
100%, yes. Yeah. Would have broken it out into developmental ranges with more time, but yes. So especially the insights that we send where the LMs that we use are taking into account age and then adjusting what the recommendations are based on that. In terms of the alerts, a lot of them, the alerts right now are just really the high risk alerts for AI. And so if they're using that, we're going to be pretty explicit about what it is, regardless of age. So if it's sexual content or if there's risk for grooming or something like that, but those are things that are a little less tailored towards age, but over time most likely can be adjusted.
Can you just clarify for me, Debbie, because it seems like AI is integrated into a lot of different apps now. What do you consider to be an AI app? Or what are some of the most common AI apps that you're seeing?
Yeah, so the most common amongst our, I can speak to the user base, but ChatGPT is a big one, right? Character AI, Polybuzz. There's kind of there's a list of kind of ones that they're using. Yeah. Some more often than not, but there is a distinction between an AI app and then a social AI app, right? And so that's kind of another distinction. And so we've been working on a framework around how to rate these apps and provide kind of a general rating of risk.
Fantastic. Important work. Thank you so much.
Yeah.
And last but not least, Dr. Schenberger, you are up.
Can everybody see this okay?
Looks great.
Perfect. All right. So I am going to talk about the development and pilot testing of an asynchronous online preschool teacher training that reduces exclusionary discipline in preschool. Just some background for me, I am a postdoc fellow at the University of Illinois, Chicago in the Department of Psychiatry. All right, so preschool expulsion, and yes, I mean preschool, this is a real thing. It is happening at an alarming rate. And like many of our institutions, certain children and families are disproportionately excluded more than others. We know from the literature that boys and Black children, bigger and older children, are more likely to be excluded than their peers, as are children with disabilities and children in foster care. And we are seeing both what I call formal and soft expulsions going on. So those traditional ways of telling a family that they're not welcome back at school tomorrow, as well as those more indirect ways that kids are pushed out of programs. So calling parents for early pickup over and over again, things like that. And we know that expulsion doesn't change behaviors. Children just learn that they are not welcome or wanted at schools. So what do we do about that? The first thing is to understand why this is happening. And through a large systematic review, we found that research is largely pointing to teachers' emotional capacity as one of the more consistent predictors of exclusion. And so we wanted to create something that addressed this and also met the needs of the community. So we heard from kind of state and local stakeholders that they really wanted a training to increase awareness of expulsion. But we know from the literature that information without skills really only gets so far. And we were hearing from teachers that they really wanted to know what to do in response to difficult behaviors and challenging classroom scenarios. So that's where PEP comes in, or Preventing Expulsion in Preschool. This is a virtual and asynchronous professional development training, and it's really designed to be an accessible and a scalable resource. Modules are 20 minutes long, only covering about 2 hours in content total, and designed to be completed every couple of days over a few weeks. So really trying to reduce teacher burden here, because we all know that they are overworked and underpaid. And this training was approved by the state of Illinois and carries 2 continuing education credits. So slots right into an existing requirement that teachers have. So there's 5 modules in PEP. Like I said, the first part is this information part that our stakeholders were calling for at the state level. And then the second half of the training is a skills-based component that is adapted from existing evidence-based parent training that's really designed to help adults increase their emotional capacity for managing unwanted behaviors. And I'll touch on some of the ways that we engage teachers through this training using adult learning principles. So one of the main things that we put in the training was really step-by-step what to do with yourself and your own reaction in response to a meltdown, and use some metaphors here. We had videos that teachers could go through to practice some of the skills that we taught in this training, as well as readings that tailored the training, or the skills specifically to the classroom. We had a variety of worksheets that teachers could go through and videos kind of guiding them through the worksheets, as well as step-by-step instructions for how to access other resources that they have access to. So we did evaluate this training. We had 41 teachers complete the training and the evaluation, demographically pretty similar to our early childhood workforce here. And we had teachers complete questionnaires pre-training, immediately post-training, and then 3 months post-training to assess for any sustainability of the training impact. And from a qualitative standpoint, teachers were pretty satisfied with the training. They felt like it was the right length and a good use of time. And they really appreciated having the skills. Most folks were calling out specific skills that they were using in their classrooms from this training. Quantitatively, we did see sustained improvements in trauma-informed attitudes. You can see that there was a significant improvement from time 1 to time 2, so pre to post training, and that improvement was sustained at a 3-month follow-up time point. We also saw improvements in self-care utilization over time and decreases in perceived stress over time. This is pre-training to that 3-month follow-up time point. And arguably most importantly, we saw all aspects of exclusionary discipline decrease over time. So both those kind of soft exclusions, I call those the in-school and out-of-school, so are you sending the child to the director's office or calling parents for early pickup, as well as those formal expulsions, all dropped at that 3-month time point. So in conclusion, we can infer from this that high quality and evidence-based professional development is important, right? How many of us have just clicked through modules for trainings just to get through it? I am guilty of that. But I think when we want these to be effective and really have more of an intervention flair, it's important to adhere to those adult learning principles and really try and engage teachers and adults in a variety of ways. We can also see that brief interventions have the potential to improve trauma-informed attitudes and that change is sustained over time. And importantly, this training builds teachers' self-regulation and not their behavior management skills. So this is really taking a strengths-based approach and saying that teachers already have good skills to manage these behaviors, but we want to make sure that they are best positioned to be able to use those tools. So in sum, this was a likable, effective, and scalable training. Teachers clearly want skills. That was our main source of feedback, was that teachers were wanting more. And currently this is free and available for educators in Illinois, and work from this is under review, so more is coming. And that's everything. I'm happy to take any questions.
Awesome. Thank you so much. Great talk. Any questions? Either in the chat or feel free to unmute. I'm also a clinical psychologist, so I'm pretty good with warm silences, but I will ask a question. I'm curious about how the teachers were recruited for this study. Just if you could say a little bit more about this.
Yeah, so we had access to some teacher listservs from community partners as well as prior studies. And then really just kind of going through, especially areas in Illinois where we hadn't recruited a lot from, and just kind of cold emailing program directors that had emails available on the internet.
Right. So it wasn't necessarily like they were struggling a lot and...
No, I mean, I will say to some extent, there's a self-selection sample, right? Teachers that are interested in taking this training may have kind of come across expulsion or used it. And we know teachers feel a lot of remorse when they have to do this. So I think there's some of that for sure.
And a question in the chat, is the decrease in expulsions and exclusions self-reported by the teachers?
It is. Everything's self-report. Yeah. It would be great to have observational data, but right now that's all we got.
Great. And did the teachers share what specific aspects of the training they found most impactful for them?
Yes. So a lot of teachers appreciated, we had modules on mindfulness and self-care. I think those were the two biggest kind of skills that teachers reported liking and using.
Elise, I'm curious if you could say a little more about what trauma-informed attitudes means and how you measured that.
Sure. So we measured it using the ARTIC, which is the attitudes related to trauma-informed care, I believe is what that stands for. And that's a pretty well validated measure of trauma-informed attitudes. And really the idea here is to get at teachers' perceptions of behavior, because a lot of the behaviors that kids are expelled for are very developmentally normative. And so it really comes with this kind of, how are we perceiving this behavior from this child? Where are we attributing the kind of driver of the behavior? Is it because the child is bad, there's something wrong with them, there's something wrong with me, versus, it's situational, it's normative, that kind of thing.
Thank you.
Mm-hmm.
Okay. Any final questions for Dr. Schenberger or for any of our speakers? Yeah, do you have a few more minutes? Any takers? Okay. Well, I just would hope you all join me in thanking our speakers for a set of fantastic talks, great presentations, and I'm excited to look into some of these absent programs a bit more after this. Thank you, everybody. Enjoy the rest of the conference.